I do want to pick up though. You mentioned, verification and that aspect of, authenticity and cyber trust, if you will.
Yep.
Tell me a bit about, you do this, your industry for a living. How do you see that help fitting in with these shifts I talked about in digital health?
As far as the opportunities are concerned, I think the notion of being able to deliver a simple experience, a simple engagement to a customer, to a patient in the healthcare world, where that patient can engage and feel confident that they can log in. They don't have to worry about personal details, that they're confident that there is a secure, simple engagement process, and they can then start to navigate whatever it is that they're trying to do, whether it's book an appointment, verify, a blood test, just do a regular health check. So the notion of whether you want to call it ID or verification or authentication, is so critical for us to be able to engage in a digital reality. If you can do that in a very easy engagement to authenticate and verify who you are and you're engaging with the right person, then it actually removes all the friction, and we can move away from, some of the rhetoric around privacy and security, and actually just start to think about how we deliver better experiences, how we put control back into the hands of Canadians to manage their health, to have access to the data. Back to your point, all of this, the promise of these richer experiences really rely on fundamentally being able to provide that digital engagement first.
Debbie, I love that framing. The way you framed the value of verification, you didn't give me your technocrat. That's not the language we use. We talk about why you need to verify because we come from a place of risk, not to unlock this value from digital and healthcare. I just think it's a huge reframe that's sorely missing.
There has to be a level of confidence and security in the engagement. And luckily for us, technology has allowed us to do that, whether that's kind of voice recognition, whether it's facial recognition. We do that every day buying a coffee using our phone. Right? So it's not like, and as Canadians, we've done this for years in the payment space, tapping your debit card at a point of sale. You don't think as a consumer, oh, how risky is that transaction? Because it works. It works the same way, and it works that way every time. And it's, what technologists do is they try to build in those capabilities to make sure that behavioral change can happen. And that's happened in many different industries. So it sounds like, we are at the right point to start to apply that to the healthcare industry.
So, just thinking about these, I don't know if you call them privacy panics. I'm sure they're not unique to healthcare.
What's our most important asset? Our health. So this is not trivial. It's super important, and our privacy goes hand in hand with that. At Interact, we've done a number of research activities, and in one of the recent surveys, over 60% of Canadians that we surveyed said that they care more about keeping their identity data safe than they did in the past. So it's a really important topic for us. But this is, I think, a lot about, well, how do we do that? How do we ensure that you can authenticate easily? How do we deliver confidence into the ecosystem? How do you ensure that those experiences work the way you expect it to work, the same way every time? That's how you change behavior. So I think there are definitely some learnings from the payment space that we are applying, whether that are some technical terms like credential management and tokenization, where privacy and customer data is actually not shared.